Hi, I'm Darshni. I'm from BBM. Today, I'm going to explain about the cholesteatoma disease. Before we go on to the disease, let's first see the anatomical structure of the ear. This is the anatomical structure of the ear. The ear is divided into three main parts, starting from the inner ear, which consists of semicircular canals, vestibule, which are classified under vestibular apparatus, vestibule or cochlear nerve, cochlea, oval window, and round window. Next, we move on to the middle ear part, which consists of auditory ossicles, symphonic membrane, and eustachian tube. Moving on to the outer ear of the ear, which consists of temporal bone, external auditory canal, tragus, lobule, auricle, and helix. Now let's look onto the physiological function of the ear. Hearing is the process by which the ear transforms sound vibrations in the external environment into nerve impulses that are conveyed to the brain, where they are interpreted as sounds. Now, what is cholesteatoma? Cholesteatoma is an abnormal non-cancerous skin growth that can develop in the middle section of your ear, specifically behind the eardrum. For some, it may be a birth defect, but commonly it is caused by the repeated middle ear infection. This image here shows the real image of cholesteatoma, and this is the graphic version of it. Now let's look onto the symptom of this cholesteatoma. How to know whether you have cholesteatoma? If you have cholesteatoma, you hear a constant sound inside the ear. Dizziness or vertigo. People with cholesteatoma might be having ear infection, earache, feeling of fullness in one ear, fluid that smells bad and leaks from your ears, trouble hearing with one ear, and weakness in half of your face. Well, the diagnostics for cholesteatoma. The doctors will examine the inside of your ear with an otoscope. A CT scan is recommendable if there is no obvious signs of cholesteatoma. Now, what causes cholesteatoma? Cholesteatoma caused by the repeated middle ear infection. It also caused by poor functioning of eustachian tube. How to treat cholesteatoma? The cyst which formed due to cholesteatoma can be removed surgically before it grows large to treat cholesteatoma. Another way to treat cholesteatoma is by following a regimen of antibiotics prescribed by the healthcare professionals, using ear drops, and carefully cleaning the ear will be prescribed to treat the infected cyst and drain the ear. How to prevent cholesteatoma? Sadly, there is no prevention for cholesteatoma. But how to prevent it? You can be aware of the condition, aware of the symptom, so that you can prevent the cholesteatoma by quickly identifying and treating the cholesteatoma. Cholesteatoma can also be prevented by treating ear infections quickly and thoroughly. Now let's look onto the prevalence of this disease. Cholesteatoma has been implicated as the causative factor. We studied 76 cases of suppurative otitis media presented with complications and found that only 64% had cases with cholesteatoma. Granulation were present in most of the cases of intracranial complications, which carries a percentage of 16.68. Well, these are the references that I used to study about this disease. If you want to know more about this disease, then you can definitely go and check all these references. I hope you find this video useful. Thank you for watching.